In this section, we're going to talk about some of the visual impairment issues an athlete may experience that will affect their performance, and they may not always be that obvious.
Yeah, there's definitely some global things that we look at and that we all need to be aware of that you can even ask or yourself can just look at, and that can always, or that may impact our performance.
I think one of the obvious things that we don't think about sometimes is the athlete seeing as clear as they possibly can. Something as simple as a little bit of uncorrected refractive error can really affect someone's reaction time. Something like watching a soccer ball leave the foot and knowing the spin as it leaves the foot will help you significantly judge where the ball is going. And if your athlete is delayed in their response, a lot of times that's the reason behind it, and it's a very simple fix.
Yeah, and sometimes what we'll do is we'll look at each eye individually. A lot of times in pre-participation physicals, we're looking at both eyes together, but sometimes it's one eye that's carrying the weight of the other. And when the brain doesn't get the really good information from both eyes, that will also affect timing, their depth perception, and their ability to really track the ball too.
Now, often you may see a doctor doing a color test and looking at how the eyes move independently. Well, in sports vision, we take that to a little bit more of an extreme. We're actually worried about how the eyes move in unison throughout the gazes of vision, because often athletes, they're rarely staring straight ahead. Often their eyes are being pulled, or their body's moving in different directions, which then causes their eye muscles to change direction.
Yeah, and so part of that is within what we normally do is what are called entrance skills. After we check how well you're seeing, we'll look at, often how your eyes are aiming, and we look at it in different ways that we're looking that are relative to that sport. So if your eye care provider is not checking in at least a couple different ways that you look, ask them to go and look. Say, hey, most of the time when I play, I'm looking up, then have them check that in up gaze. Along with that, we'll also check to see how well the muscles are moving together. So that way we know it's a really sophisticated organ, or their organ system that's in there with the extraocular muscles that are really trying to make sure that both eyes are pointing in the exact same spot the whole time. We want to make sure that occurs in every position of gaze.
And it's interesting, we've shared cases like this on Sports Vision Pros about pro athletes. We've had professional athletes that have always passed eye chart tests their entire career, and then we find out like a batter in his gaze at the plate is actually having his eyes split and seeing double that he's trying to struggle through, and that's some stuff that was just never checked. So these are all critical things that we take in account when we're checking, especially a sports-specific exam.
Yeah, another option, or another thing that we look at aspect is actually our peripheral awareness. So the work done at University of Cincinnati, we know that peripheral awareness really helps it actually decrease their concussion rate as well. So it's one of those things where we're going to check their side vision, make sure they can see it, at least at a gross level.
And that's something that moves us into a whole different area. We always talk about sport and vision performance, but to us, vision performance is also safety. You perform better and keep yourself safe. And the whole idea and what was shared with us with some of this information from the University of Cincinnati is we can decrease concussion rates, we can have players much more aware, we can reduce injuries simply by having them have better peripheral awareness. And that's something that I think we can change the way that sport is done, especially the training is done at a young level, will have significant repercussions for athletes and for the rest of their life, really.
Yeah, a lot of our athletes say they wish they had done this in middle school or high school, and they notice it. And so what we do is with our trainers and with our sports medicine staff, we actually are able to train this. So everything we're kind of talking about, we want to be able to train it as well to make it even better. That includes how well you see. That includes where your eyes tend to aim and also your side vision.
Now, keeping in line with deficiencies and things that may affect an athlete, there's other things that we'll check for, and these aren't as obvious, but sometimes color vision anomalies can affect how an athlete performs, especially in today's day where we're using a lot of different contrasting colors for elite sports. That's a simple one. Young men are obviously much more prone to that than women, but we'll still check everyone for it. Even health situations can actually affect someone's performance. Something as simple as dry eye or your eyes drying out can affect the contrast of what you see, which means how early you react, and it can also affect glare. And glare can be a significant issue that we also can address with not just health reasons, but there's also devices that can address glare.
Yeah, for sure. I mean, we can look at devices, we can look at contact lenses that will actually darken when they get in bright light to help decrease that glare. Those are the Acuvue Oasis with transitions. We can also look at nutraceuticals that the studies have shown that they help with contrast sensitivity and glare recovery. So there's multiple ways that we can do this. And one of the things that we just mentioned, contrast sensitivity, that is actually probably an underrated thing that's out there. And that's something that you want to make sure that your eye doctor is checking to see how well can you see different shades of colors, and let's try to maximize those. And that can often be done with contact lenses, glasses, and other ways like nutraceuticals.
And Fraser brings up a great point. Some of these deficiencies that we're looking for are not easily testable, but when we do test them, they are improvable. Contrast sensitivity, for instance, is how you see the real world. When you go to an eye exam, that black and white contrast isn't what you see when you leave that eye doctor's office or that chart when you're at your pre-physical screening. Contrast sensitivity is really how you interpret everything around you in the world, and that has recently been shown to be trained, meaning that through certain exercises, through certain devices, we can actually improve an athlete's ability to pick up motion, detect motion, and even reaction times.
Yeah, which is amazing, right? We can help those reaction times by improving contrast sensitivity and just being aware of movement. So it helps reaction time. It also helps confidence of a lot of these athletes too.
You know, so one of the things that I do want to end up on as we're finishing talking about the idea of subtle issues that athletes may have with their vision is also the idea of what the athlete knows is normal to them. They don't know that there's a deficiency. So if an athlete's always growing up with something, if a child will do an incredibly good job at adapting to what they have, and so they can perform at a pretty high level with some of these deficiencies. And we're very careful when we identify these with some athletes. If they're already high level, we're careful with how we train these or alter these because of the human system. The human system can adapt, but certainly if addressed, you can notice some significant increases in performance. Wouldn't you agree?
Oh, 100%. Yeah, it's amazing. I think we all take it for granted. We think we're born with the vision that we have, but we can actually improve it. So that way we can improve reaction time. We can improve safety in that respect too. And then we can also look at just better field awareness. I mean, all sorts of different things. And I think one of the things that we hear from coaches often, and even trainers, those individuals that sometimes have vision problems, it's the fact that they are inconsistent. They struggle during pressure situations. They have a ton of potential, but they're not living up to it. And everything we've talked about, you know, it affects timing, reaction time, tracking, depth perception. That if people are struggling with that, it can be their vision.
You got it. So for this segment, please stay tuned to the next segments where we're really going to show you the roundabout way of how sports vision is incorporated into the athlete's life, and also some of the issues that we have with other devices that we use to help train or even protect athletes.
Yeah. So thank you for joining us, and now we're going to pass it on to
Dr. Smith.